Hello again everybody. Thought I'd do a quick video here on my sort of everyday carry first aid pack, which if I'm going to about is normally in my bag. It's one I've put together myself. It's the basic sort of thing, but it does the job. And what I've used here is a Mylar bag. Now these Mylar bags are available quite cheaply. They're waterproof. They've got a Ziploc across the top here. And you can also seal them if you really want to permanently seal them. You can seal them across the top with an iron or a heat sealer, and then you can actually tear it with a notch here. And then obviously you've still got the Ziploc component to reseal afterwards if you want to make sure they're sort of tamper-proof. These are available quite cheaply. I think I got a pack of 20 of this particular size for about £4 or £5 from an eBay seller. And the first aid sticker, again, you can get those quite readily available online if you really want to do that, or just colour in a cross on the front or write first aid on it. These Mylar bags are quite tough. They're used for food, for long-term food storage, normally with an oxygen absorber and things like that. So you can get various sizes. You can get the gusseted bottoms which will stand up, or just this size. And this is pocket size, as you can see. It's not huge, but it does the job. And as I say, inside here, once we actually open it up, I'll sort of try and get some of the contents out. It holds quite a lot, and obviously the bag is also useful for other things, should you need it. But basically what I've got here is the basic Mylar silver space blanket, heat retaining blanket. Ideal for first aid kits. If somebody's obviously unconscious, you can actually, if you want to put them in the recovered position, you can roll them onto this. So it actually insulates them from the floor, which is very good in cold weather. If the person's already cold, they don't do much apart from obviously keeping them dry if it's raining. They only really reflect body heat, so you have to be reasonably warm in the first place to actually get much benefit from these. If you stick a really hypothermic patient in one of these, it's not going to actually warm them up, but it will protect them from the elements. And these are really large and ideal. The only thing you also have to be careful is they are flammable, so you need to keep them away from heat sources. They will catch fire quite quickly, but they're very cheap, very inexpensive. You can get these sort of things from Poundland, from any outdoor store. For certainly for Poundland, you can get a pack of 2 for £1. You can get them anywhere really. Next up is triangular bandage. I tend to use the non-woven variety. This one is branded St John Ambulance. You can get them the calico type, the cotton type, which are obviously more reusable. These ones pack down very small. I mean, it's 127 centimetres along the base, by the two other parts and 90 centimetres of the triangle. But it packs down nice and light, and there's a safety pin included in there as well. You can do so much with the triangular bandage. You can use it, although the one isn't sterile, you can control bleeding with it. Obviously you can use it to support injured limbs. You can use it to hold a dressing on the head. You can use it to hold dressing on the closed fist. You name it, you can tie limbs together with it. There's so many uses for triangular bandages. Every first aid kit should have at least one of those. I'll go on to this part next. We've got sterile first aid dressing. This one is a size 8 or medium. The actual pad size is 10 centimetres by 7.5 centimetres, so it's going to deal with most small to medium size wounds. It has a conforming bandage, so the bandage is very easy to apply and can either be pinned or taped to itself. Invaluable really for controlling bleeding, and very inexpensive as well. I have 2 adhesive dressing pads. Again, these are 10 by 7.5 centimeters. You can probably see from inside the wrapper here, they have something on the back called Hyperfix. And Hyperfix is a ventilated adhesive dressing, which is this part here, and in the middle you have the small gauze non-adherent pad, which you actually put obviously to the wound. They're like large plasters really. They're brilliant for children with grazed knees, elbows, anywhere where it's got to be on a joint which is difficult to attach other dressings. And so I've got 2 of those in there. Now we come on to some of the sundry items. I have in this bag here, I have 4 sterile cleansing wipes. These are alcohol free and contain saline, and they only contain saline. It's ideal for cleaning around the face, the eyes, and wounds. You're not going to irritate a wound with saline. Very, very good, and they're very, very wet as well, these wipes, so ideal for cleaning up afterwards, or actually before you put any of the dressings on. As mentioned earlier, the adhesive dressing pads have something called Hyperfix on the back, and this is a strip of Hyperfix which can be used to tape down dressings. You can make your own size plasters by using gauze in the middle. A very, very handy addition to a first aid kit. And to go with that, I have a low adherent dressing, which is basically, it's the middle part of one of these without the adhesive around it. So again, you can use that to control bleeding before you actually dress it, or you can actually put that directly onto a wound, and then you can tape it with your Hyperfix. I have a selection of plasters. I say these came from a local supermarket, so quite cheap and cheerful, but they do the job. They're waterproof plasters, and we've got a normal size plaster, band-aid as they call them in the States. I have a fingertip dressing, shaped like a bow tie or or butterfly, and that basically goes over the top of the fingertip and is then taped over the top. So if you've caught this part of your finger or a nail, you can use that quite nicely. We have a knuckle plaster, and this would be applied to this sort of area here, and then these ends can be wrapped round. It's also good for here and heels. It'll stick to the back of a heel quite nicely, and you can adjust the actual winged part of the plasters. Got some more general purpose plasters, and 2 more of the knuckle, or they're also called anchor plasters. We have a resuscitation face shield. This is the plastic one, and all you've got in the middle of it is you've got a piece of heat sealed into the middle, piece of material which acts as a one-way valve, and basically stops you from having any contact with the person's mouth or nose if you're giving mouth-to-mouth resuscitation. Very slim and compact. Our instructions, usually it's guide to CPR on the back, and very handy and a worthwhile addition. You can fit in a wallet. I carry one of these in my wallet as well, but also obviously in this first aid kit. I have hand sanitizer wipe, so when I've finished, about to pack everything up, finished doing my good deed or treating myself or anybody else, these are basically, this is alcohol wipe, so I can make sure I clean up after myself, clean myself down if I've got anything on my hands, which I won't have because I've obviously got some gloves which I'll come to in a moment. But these were a pack of 20 and came from the local pound shop. Also we have, you might want to use this beforehand, this is the alcohol gel in a sachet. Instead of carrying the big tub around, or the tube, or the squeezy bottle, you can get them in sachets, exactly the same ingredient, just a lot more handy to carry really. I'm talking about gloves. I've got a pair of black nitrile gloves. Latex isn't used anymore. Too many allergic reactions to latex, both for the user and for the patient. So these black nitrile gloves, they're powder free, so you don't want to get any of the irritation from the powder, and they're wrapped up quite tightly. They're actually these ones used by tattoo artists and things like that, but they were cheap. Bought them online for a box of 50 of them. We also have in here some safety pins, and the two little vials at the bottom are snap lights, very small Kylune light sticks, so you can snap those, and there's enough light there to work from if obviously you're doing things in the dark. You can find things in the kit. I have a pair of folding scissors. Well, these are the smallest folding scissors I could find. Ideal for first aid kits. Nice and sharp. And I said I want to try and keep the weight and the size down, because obviously the bigger the first aid kit, the less likely you are to carry it. I don't know about your person, that is. So the scissors. I also have a very small stainless steel surgical blade. This is the hooked type. You can just about see the profile of the blade through the packaging. This isn't really for any surgery as such. It's handy for cutting clothing. It's handy for 101 things really. It's got a very, very fine tip, which may be of an advantage to help remove splinters. I haven't got any tweezers in this particular kit, but it's something you could add if you wanted to. You can open packages and things with it. It's an all-round useful item to have. Very sharp, but safer than a normal scalpel, because obviously it's got a hooked blade, so you're not going to. It's actually used for removing stitches. So if anybody's had stitches and haven't been removed, then obviously you could remove them yourself. But that's basically what that's for. I have 2 300mg aspirin tablets. Obviously, if somebody's having a suspected heart attack, allergic to aspirin, then obviously you could get them to chew one of those slowly while you're waiting for medical help. Or if you've got any pain, aspirin is still a great reliever and reducer of temperatures, and also an anti-inflammatory and pain relief. It's one of the oldest tablet forms of painkiller that we still use. We'll have a small plastic bag. It's not the normal yellow for clinical waste. Hopefully you're not going to have any clinical waste if if you clean things up as you should. You can hand over to the ambulance service if it's something major, but just for basic sort of used packaging and bits and pieces can go in there. It's a 1 gallon plastic bag, a bit like a freezer bag really, and just handy to have in there, and can also be used for other things. If someone's got a penetrating chest injury, you can open it up and you can make a makeshift chest seal and things with that. So we're always handy to have plastic. And last but not least, something that's very hard to get in this country is this, which is a triple antibiotic ointment. It's called Neosporin, and it has 3 types of antibacterial agent in it. It's got neomycin, polymycin, and bactricin. And you can't normally buy this in pharmacies in this country, in the UK. You can order it online. You can get it from Amazon, etc., etc. You can get it in tubes. I got some packs of the individual sachets. It's very handy for insect bites. Prevents infection, or will help to prevent infection. Splinters, after you've had a splinter, you can put some of that on. Minor burns, cuts and abrasions, and there's quite a large amount in the actual sachet. It's they haven't skimped on the sizes. I mean, there's 0.9 grams in there, so it's going to do for most sort of minor wounds. But it's better than having a big tube of antibacterial cream or antiseptic cream. if you can have it in a sachet. And everything which you can see here, all down there, all packages up into a waterproof, light-proof, heat-proof to a certain extent Mylar bag, which in itself can be used for other things, and also you can reseal the equipment you haven't used. Inside, the only thing I haven't yet done on this is included a sticker on the back with the contents and the expiry dates, which is something which I shall be doing next. Well, that's my my first aid kit, everyday carry bag, first aid kit pouch, call it what you like. Something which I think everybody should have. And hope you've enjoyed the video. If you have, then please like. If you haven't already subscribed, then please subscribe. And I hope to be back again shortly with another video. Thanks for watching. Bye bye.